don't exercise enough. And I think I was reading something the other day. Sugar is so bound up in our culture because of our history of our sugar industry. So you can't take away sugar, it seems like.
Hmm.
Um, and you can't take away the sugar diabetes from Bajans either, it seems like, as well. So, we have a lot of diabetes in Barbados, and that leads to heart disease. We have a lot of hypertension in Barbados. A high salt diet that plays into it. I think our genetics also has a big role to play. Genetics has a role to play as far as diabetes as well. Um, uh, but then when you look at the background, and the things that predispose to these two NCDs that then lead to heart disease, a lot of it is actually lifestyle. So the culture of getting up and exercising or being physically active, if you don't like the term exercise, is not one that is bound up in the Bajan psyche. Um, and maybe I'm generalizing. I don't think that it is as as emphasized,
Hmm.
in your average cultural discussion as it could be.
Okay. Well, we are going to take a quick break, and when we come back, I'd like you to just explain to us how diabetes and hypertension impact the heart. So we're going to
Okay.
ask that of Dr. Scantlebury when we come back. We're becoming heart smart tonight on Your Health, Your Action with the help and assistance of Dr. Don Scantlebury, who's a consultant interventional cardiologist. And just before the break, and I'd like to remind you that you can participate in the program. You can call us with your questions, and the numbers are 228-5562 or 228-5563. And we welcome your comments as well. You can also WhatsApp us on 228-5562. However, Dr. Scantlebury, before the break, I did ask you, how does diabetes impact the heart? How does it affect the heart and also hypertension?
Diabetes leads to high levels of blood glucose, and over a certain level of high glucose, um, the sugar molecules get attached to different proteins in the bloodstream and in the tissues, um, and those are kind of toxic to the blood vessel. Um, so it leads to an increase in degenerative disease called atherosclerosis. So atherosclerosis is the laying down of cholesterol plaque or fatty plaque within the walls of the blood vessels. Um, And over a period of time, that leads to blockages and narrowings in the blood vessels. Atherosclerotic cardiovascular disease is therefore a vascular disease where the blood vessels that supply tissues become blocked, and you get a decrease in blood supply to those tissues. So one of those tissues is the heart. If you have a decrease in the blood supply to an area of the heart muscle doesn't work as well as it should. You can get weakening of the heart muscle. If it happens acutely, where you get that cholesterol plaque and the lining ruptures and you get a clot forming in the blood vessel, that can happen all of a sudden and you get a heart attack. That's what a heart attack is. You can get also heart failure as a result of that weakening of the blood vessel. So heart failure is a syndrome where you get shortness of breath on exertion. You can get shortness of breath at rest if you have significant fluid retention and fluid within the lungs. Patients can have like swelling and they can have significant fatigue, and it's because of that weakness of the heart muscle and the reduction in the ejection and the cardiac output. So that's diabetes. I guess there are other ways as well, but that's the main way. Ischemic heart disease or coronary artery disease is that condition that I just described. Hypertension causes an increased load on the blood, on the heart muscle. So every time the heart squeezes, it has to squeeze out blood against that high blood pressure. So this is the artery that the heart squeezes into, called the aorta. Every time the heart squeezes and this pressure coming back at it is higher than it should be, the heart has to squeeze harder than it should. So that leads to hypertrophy or thickening of the heart muscle. That hypertrophy is okay if it's your arms or your legs, when you're working out and trying to build muscle, but the heart muscle, which is a different type, is not designed to do that. Your heart is designed to work efficiently with a certain blood pressure. If your blood pressure is higher than that, as I said, it gets thicker, and over a period of time, that thickening leads to scar tissue formation and then ultimately weakening of the heart muscle. And again, it can lead to heart failure.
Is there any way that you all can tell this without having to do any surgical procedure? Is there some way that you can see that in early stages, or not just waiting until the end when you have that heart attack? Can you tell these things?
We can actually. There are a lot of tests that we can do for to screen for ischemic heart disease or coronary artery disease. The question is it cost effective, and is it going to make a great deal of difference? So we screen patients if they have symptoms. So if you have chest pain on exertion, which might suggest that you have narrowing and a decrease in blood supply to that heart muscle, we can do testing to look for that blockage. But before you get to that point, the important thing to do is to treat the risk factors aggressively to prevent you from getting the heart disease anyway. That leads us to the issue of prevention. So there's primary prevention, where you have all of these risk factors and you're treating them aggressively. You're treating that diabetes, you're treating the hypertension, you're treating the high cholesterol, and you're treating all of these to a specific goal to reduce your risk of developing heart disease. Of course, this heart disease, as I said, is also a degenerative condition. So atherosclerosis or cholesterol plaque is something that comes with age, regardless of whether you have risk factors or not. It's just your risk of it is significantly increased if you do have those risk factors. So going back to your question of screening and trying to find these things before you get to the end, symptoms are the main screening test, to tell you honest truth. If you start to develop symptoms of shortness shortness of breath on exertion, decreased exercise tolerance. You know, you used to be able to walk up that hill with ease, and now you find that it's a little bit of a struggle. These are warning signs to prompt you to go and get checked out. Because obviously you can't take the 200,000 people in Barbados who are over a
Quite.
certain age and send them for an ECG and or stress ECG on a treadmill to do it. It just, as I said, is not cost effective.
Right.
That's why it's so important to focus on symptoms, but also the screening that you do is screening for that high blood pressure, screening for the diabetes, screening for your cholesterol levels, and managing them appropriately.
You mentioned an ECG. I've heard the term before as an echo something. What exactly is an ECG?
So an ECG is an electrocardiogram.
Electro,
It
that's
is
it, yes.
Yeah,
Sorry.
it's a heart tracing. So it looks at the electrical activity of the heart. You also just mentioned another term, an
Yes.
echocardiogram. That's an ultrasound of the heart. So we
Okay.
do ECGs. ECGs are fairly basic tests. They're like, you know, one of the cardiologist's vital signs. So you come to see me, I'm going to do your vital signs and an ECG as you walk in the door. If you're a new patient, because I get information from an ECG, it tells me if you have an increase in the voltages. So as I said, it's an electrical test. So we're
Mm-hmm.
talking in terms of voltages, etc. So if you have higher voltages than usual, it might suggest that your heart muscle is thickened. If you have lower voltages, there's another reason. If those little squiggly lines on the ECG are not normal, it tells me different information. And then the most important thing I'm looking at well, not most important, but one of the big things I'm looking at for an ECG is your rhythm. So, uh, again, an ECG is looking at your electrical activity, and disorders of the electrical activity of your heart can lead to abnormal heart rhythms, which
Okay.
is an arrhythmia.
Arrhythmia.
Um,
So
yeah.
when you speak now of abnormal heart rhythms, is this a quickening of the rhythm, or a rhythm that is slow and perhaps missing beats?
Any one of those. So it could
Wow.
be slow, it could be missing beats, it could be irregular, it could be just a lot faster than it should be. You are one of the way people often present is with palpitations, so they're feeling their heart fluttering or skipping a beat or racing. Sometimes they're just more aware of a normal heart rhythm.
Mm-hmm.
That's also falls under the category of palpitations, even though there's nothing wrong necessarily with the heart. Um, uh, but sometimes they don't feel their heart. Sometimes they get lightheaded or dizzy or faint, or even the term sudden cardiac death is a presentation of an abnormal heart rhythm. So, from the very, very benign to the very malignant are the ways that abnormal heart rhythms can present. Um, yeah.
Okay. How important is stress as a factor on heart disease?
Stress, often by itself, when you look at the studies, is not a direct cause of most heart disease. There is one particular heart condition that we call a stress induced cardiomyopathy that is directly related to stress. But like when you look at the more common causes of death from heart disease, stress doesn't have that one-to-one relationship. The relationship is through all of those NCDs. So you're stressed out, you don't eat well. You eat the fatty foods. You stop at the fast food instead of cooking a healthy meal. And you get overweight, you develop hypertension and diabetes. You're working 12 hours a day, so you're not putting in the time to exercise. You get overweight, you develop diabetes and hypertension. So the stress often works through those other NCDs until you get to the heart disease. There are, instances where people who are under high and significant levels of stress, just because of the stress, can have higher blood pressures than usual. But usually it's uh, mediated by the development of the other entities. And a lot of it is lifestyle related again. Interesting thing about that, stress-induced cardiomyopathy, and putting my plug for one of my research interests is heart disease in women. The stress-induced cardiomyopathy is a specific heart muscle disease that is a lot more common in women. So 90% with it will presenting with it are women, and it presents a little bit like a heart attack. So that's that one condition that is a direct result of stress. But stress usually goes through lifestyle factors.
Whenever we discuss NCDs and so on, and you mentioned diabetes and you mentioned hypertension and a heart disease, obesity is also mentioned. Why is this? Is it that because with that comes those other things?
Typically. There are some associations with direct associations with obesity with heart disease. So there is another, again, a heart muscle disease that is thought to be associated with obesity, but obesity runs in hand with the diabetes and hypertension. And then patients, there's another condition called obstructive sleep apnea, which is a lot more common in patients who are obese. And that can lead to, again, hypertension, abnormal heart rhythms, and heart failure. But a lot of it is your is again a lifestyle problem that is, comes as a result of too much caloric intake and too little caloric output, and that is one of the things that leads to high blood pressure and diabetes as well.
You mentioned sleep apnea. How does one know that one has sleep apnea, or does one have to be told that you have it?
Sleep apnea is it's a condition where you stop breathing at night, and it's often associated with snoring. So if you know anyone who's a really heavy snorer and they do the thing,
Wow.
where they're snoring, and then they snort, and it seems like they've had stopped breathing, and then they start back. That could have been an apneic spell. Apnea means to stop breathing. And with obstructive sleep apnea, patients do that multiple times in a night.
Wow.
And their sleep is very interrupted. And if you do studies on people who have sleep apnea, every time they have one of these spells, the blood pressure goes up. So people who observe the person with sleep apnea could actually tell them, you snore really badly, and it looks like you stop breathing when you're snoring. But the patient themselves may also have an inkling if they find that they wake up, their mouth is dry, they have a headache, they're very tired during the day because they haven't slept properly at night because they're waking up multiple times in the night. So they, if you go, you sit down in a quiet room and no one is talking to you, you drift off. You fall asleep whenever you sit down to watch TV. Or in more severe instances, when you're driving, you come to a stop sign or you come to a traffic light and you fall asleep. Or some people can even fall asleep just in the middle of driving. So sleep apnea can be associated with car accidents or motor vehicle accidents as well. So excessive sleepiness, excessive fatigue, abnormal heart rhythms and hypertension, and then those apneic spells at night where you stop breathing.
Okay, well, we're going to take a break, and we're going to also take lotteries. We'll take a call after we come back from that break. Okay, thank you.
Okay.
And we're watching tonight our hearts. We're keeping an eye on our hearts and learning to become heart smart. And tonight we have with us consultant interventional cardiologist, Dr. Don Scantlebury. And we have, I do believe, Don, a caller on the line. We say hello, good evening, and welcome to the program.
Hello, good evening.
Good
Yes,
evening.
I'd like to ask a question,
Hi,
please.
good
I would
evening.
like to know what type of foods you can use in order to have a healthy heart.
Thank you, ma'am.
You're welcome.
Right. Okay, that's a good question. You need to look at your diet in totality rather than look at specific foods. So you're looking at foods that are mostly plant-based. So if you're looking at your plate, and I know down on the bottom right-hand corner, at least of my screen, ever so often this plate comes up, and it has a big stalk of broccoli, which it's just one plant. But if you are approaching your overall diet, think eat real food. One, avoid junk food. Mostly plants, and don't eat too much of it.
Okay,
So when you
I'm going to ask you to stick a pin in it. Lotteries are ready. So
okay.
we're going to take a break, but it's good because that will be a perfect time. And caller, if you could stay on the line with us, we're going to break for lotteries, and when we come back, we're going to look at this diet in totality. We're becoming heart smart tonight on your health, your action. And just before we broke for lotteries, we were getting an answer from our cardiologist, Dr. Don Scantlebury, about the importance of diet and what particular foods we should be eating. Perhaps, Dr. Scantlebury, we can take a look at it both as prevention and then also as medicine, because if you do have heart disease, then what is the best diet that you should be, eating so that you can perhaps maintain or at least feel a little better?
Okay. My computer breaking up just now. Can you hear me okay?
Yes, we certainly can.
Okay, good.
So preventative and then also then what if you are then having, problems with your heart, what's the best way that you can, what lifestyle? Yes.
Yeah. So back to what I was saying about the, more. When you look at your plate, say you're eating dinner, you should cut it into quadrants. Half that plate should be, mostly vegetables. So, your steamed vegetables and some salad. When I say salad, I'm not necessarily talking about coleslaw. I mean more of a green salad. And then another quarter would be your protein, and another quarter your carbohydrate. The protein does not meat. It could also be plant-based. You probably don't need to eat meat with every meal. Going to be eating meat, focus more on lean cuts of meat. The more fish, the better. And this is a kind of diet that I recommend to patients, regardless of whether they have heart disease or trying to prevent heart disease. So the same way that you should be eating all your life is the same way you should be eating if you've developed heart disease. Again, try to avoid junk food, eat mostly more plant-based meals, and another thing you need to focus on is not eating too much of it. So again, going back to those portions on the plate, if it's a big dinner plate, try and space between the portions unless the plate is full of green salad. And some other ways that you should really be focusing on if you have developed heart disease. So if you have hypertension, for instance, or if you're at risk for hypertension, you really want to avoid excessive sodium in your diet. Again, when I'm speaking of sodium, I'm talking about salt. So, pot salt, Himalayan salt, sea salt is all salt.
Yeah, we looked at that last week and we learned that it's the sodium. So yes,
it's all the salt. It's all salt. So a lot of my patients who have developed heart failure, we strongly recommend that even if you've been eating a really low sodium diet before, you really need to be very, very focused on decreasing your sodium, because fluid with sodium, and they're at risk of retaining fluid and getting exacerbations of their heart failure. Another thing to emphasize in this very hot climate of ours is to take in adequate liquids. A lot of people, and I know I do this, interpret thirst for hunger. So instead of reaching for the water bottle, you feel there's something missing. You reach for a snack, or you reach for a meal, or eat more than you should have. And really all it was that you were thirsty and needed to load up on the liquid. So remember to drink those 8 glasses of water at the minimum, and probably even 10 to 12 when it's really hot and you've been outside.
Eight glasses of water, but how many ounces in those 8 glasses?
So that would be eight glasses. We're talking is your average,
right?
And 64. That the thing about that, when you read books and etc., it's more temperate climates where people are recommended 8 ounce glasses, right? So in Barbados, we have been temperate, and as soon as you step out the door and you walk down the street, you've lost the water through sweat and insensible losses just being evaporating from your skin. So you need to account for the fact that we probably need more than that eight glasses of water that the average book recommends.
Does the heart heal?
Uh, that is an interesting question. So if you get a heart attack, your heart does not regenerate. So if you lose heart muscle, it becomes scar tissue. You don't get back heart muscle in that area. On the other hand, if you have, say, an inflammatory disorder with the heart muscle, so say you develop COVID and the COVID affected the heart muscle and you had inflammation with the heart muscle, that can heal from that.
Mm-hmm.
If you have developed scar tissue as a result, the scar tissue itself does not regenerate, but a lot of the problem with that inflammation in the heart is just stuff, the inflammatory process and extra fluid, etc., within the heart muscle, and that can heal up. So it all depends on what kind of heart disease we're talking about.
Okay, and treatment then would be what kind of medication?
So again, it depends on the type of heart disease.
Mm-hmm.
Well, there are some pretty core medications that we use in cardiology. There are some medications called the beta blockers, which are medications that block the adrenaline receptors on your heart muscle, and they decrease your blood pressure, they decrease your heart rate. We use those in a lot of different types of heart diseases: heart failure, ischemic heart disease, or coronary disease. They're even used in hypertension, although they're not that good pure blood pressure lowering agents. There are other called ACE inhibitors or angiotensin receptor blockers. Big words that I'm using, but these are medications that work in kidneys to drop your blood pressure. And they also work on receptors within the heart muscle themselves to block hormones that can attack the heart muscle and tell it not to work as well as it really should. We use other blood pressure medications purely for the effect of lowering the blood pressure to offload the heart. So your blood pressure is high, your heart muscle is weak because of the high blood pressure. You need to treat that high blood pressure. So antihypertensive drugs or blood pressure lowering drugs are often used purely for well, not purely, or used for heart disease.
Right.
Going to that cholesterol plaque that I was talking about, as atherosclerosis is cholesterol in the blood vessels. We give you cholesterol lowering agents. So the statins are one of the most commonly used drugs in cardiology.
We have a caller on the line. We say good evening and welcome to the program.
Hi, good evening.
Good evening, ma'am.
I want to ask a question to the Dr. Scantlebury, please, and two parts. My first question is, if one has an enlarged heart, can that reverse? Can that be reversed, number one? And number two, I heard her speaking about the water, drinking lots of water. But at one point in time, I was been to the doctor with a heart issue, and they had encouraged me not to drink too much water. So a little bit confused there on that one. If you're going to drink water, but then you're saying don't drink too much water. And because in my situation, I was having swollen legs and that type of stuff. So, tell me about that and about the enlarged heart.
Did you hear her?
I missed the first question as she was breaking up a bit.
Okay, are you still there, ma'am?
Yes.
All right. Yes. Can you ask the first part about the enlarged heart again? The doctor didn't quite hear you that time.
Well, I was trying to find out if someone is diagnosed with an enlarged heart, if that can be changed or reversed by medication or anything, or once your heart is enlarged, that's it? Can an enlarged
Okay.
heart
Okay.
go back to normal?
Yeah. Okay. So it depends on again the stage and what's the underlying cause. So going back to hypertension as an example, if your heart is enlarged because of high blood, very often, especially if someone presents early enough in their disease, uh, adequate and appropriate treatment of their hypertension can lead to shrinking of the heart back to normal size. So the heart can be enlarged because of thickening of the heart muscle or because the chambers of the heart are dilated and it can be associated with weakening of the heart. Um, when that happens, sometimes the pressure inside the heart goes up. The heart isn't ejecting blood as well as it should. You're up with more blood in the heart at the end of its contraction, and that pressure can back up into the lungs. And ultimately, one of the ways that you're I'm hearing a lot of background
Yes.
noise. Uh, yeah, one of the um, ways that patients present is that they retain fluid because the kidneys are sensing they're not getting enough blood because the heart muscle is weak, so the heart isn't sending out enough blood to the tissues, and the kidneys are one of those tissues. So the kidneys are saying, "Hey, I'm not getting enough blood," and they leap into action, and all of these hormones are produced that tell the body and tell the kidneys to hold on to that water or hold on to that fluid. So then you get swelling in the leg, you get fluid in the lungs, you get shorter breath. So that's the reason why your doctor would be telling you not to drink so much water at that point in time, because you're already fluid overloaded. So
Mm.
that's a specific situation. Um, and one of the keys there, especially in patients who have heart failure, so what I've described is the syndrome of heart failure, is that sodium, water follows sodium. So a lot of my patients, I don't restrict them so much from free water, as long as they're careful not to take excessive sodium. But
Ah.
if you're really volume overloaded, if you're really fluid and water overloaded, you really and truly need to not be putting too much extra water in at that point in time until that volume overload is treated appropriately with medication that makes you get rid of that fluid.
Okay.
So that is how we treat heart failure. And a lot of some of those medications I was describing, the ACE inhibitors and other big words that you won't remember, work specifically in the kidneys to tell them not to hold on to the water, not to, it's okay. You're getting enough blood supply. You're just not. You just don't
Okay.
feel that
All
that
right.
you are.
We're going to take a quick break. Thank you, ma'am, for your question. And when we come back, let's take a look at activity, movement. I think you mentioned it earlier, but let's take a look at the importance of it in the overall
Okay.
scheme of things when we come back. We've heard that being sedentary is just as bad as smoking is to your body. Why is this?
We coming back around to the same, um, if you are not putting out very many or very much in the way of or you're not burning enough calories, you can gain weight
Okay.
and whatever. That's one reason. But exercise has a lot of very, very beneficial effects on the heart. So, especially aerobic type exercise, aerobic type activity, improves the function of the blood vessels. It decreases that atherosclerosis that I described by changing the pattern of the cholesterol in the bloodstream. So people who are exercisers tend to have less cholesterol plaque in the blood. Or the blood vessels. But it's not just about exercise. There are some studies on physical activity in general that suggest that even non-exercise activity, so there's this term called non-exercise activity thermogenesis, or NEAT. So NEAT is also associated with reduced risk of heart disease. So all of those, so NEAT encompasses all of those things that we do that we're not really exercising. So going to the grocery store, fidgeting, even when you're sitting in your chair. There are people who constantly swing their legs or move their arms like I'm doing, or they constantly get up and go to the fountain at work, or they have to pace when they're and pace up and down when they're thinking. All of that is not exercise, right? But it's physical activity.
And all of that is important.
All of that is important.
Which is why, because you mentioned earlier that some people might have a problem with the term exercise. And so I notice these days a lot of people are using the word movement, so to keep moving. But is the aerobic aspect of it the part that you want? You want the heart to keep pumping, to be active. Is that
so?
No,
all exercise, yeah. All activity is important. The more, the better. Well, there people can go to extremes, but all activity is important. So if you are not able to get up and go for a run or a walk, but you're able to do chair aerobics or you're able to do chair yoga, that's good. You're older and you have orthopedic issues and you can't walk on a treadmill. A treadmill is not the be all and end all. If you can swim, you can go and swim. That is actually a lot easier on your joints. So any kind of physical activity. But even if you have a hugely busy lifestyle and you don't have the time to set aside for to do an exercise routine, there are still ways that you can increase the activity in your day, increase those steps, going up the stairs at work, etc. And that is helpful as well, because the more activity you're doing, each time you do that, as you said, your heart rate goes up a bit, and you're encouraging your heart, your blood vessel lining to be a little bit healthier. So yes, aerobic activity is very helpful, and following a heart attack, following heart event patients to cardiac rehab, to get them started in aerobic activity. But if you're not very physically active, just going from 0 to 5 as opposed to going to 100 is better than nothing.
When we see the oximeter, that's the correct pronunciation, or oximeter, the ones that test the oxygen levels and so on, they also have your heart rate measured, your blood pressure. kits as well also monitor your heart rate. What is the optimum heart rate that we should be seeing? And what is
Heart
one
rate.
that should give us concern?
So heart rate varies very widely in a normal population. So the typical, if you read a book, the typical normal heart rate is between 60 to 100, a pretty wide range. And then there are people who are very athletic whose heart rate hangs out in the 50s as well, and even in the high 40s. But then there are some people who, if their heart rate is in the 50s and the 40s, they can barely walk because they're lightheaded. So your heart rate, it is tough to say exactly what a normal heart rate or should be. For an individual, the range 60 to 100 is considered normal, and but for some people, a little bit on the lower end, or on a slightly higher end, a little bit in the 100 to 110 range could be normal for that person. So the typical heart rate is in general around 70, 72, is what you would see on average. But if your heart rate is in the 60s and you're feeling normal with no lightheadedness, or that's normal for you. If it's 90 and you're feeling normal, that could be normal for you. But it's useful to know what your normal heart rate is.
Okay.
The other thing.
Yes, if I gave you a minute to say what's the most important takeaway you'd like us to take away this evening, because time's running out on us, what would that be?
Yeah. Focus on prevention. So focus on those, well, it used to be 7, now 8 things that the American Heart Association recommends that we do. So manage your diabetes, and make sure your blood sugar is well controlled, manage your blood pressure, make sure that's within normal range and know your normal numbers. Treat your blood cholesterol, be more active, eat healthy, stop smoking. I'm missing something. The sleep. Pay attention to your sleep. So I think I have 7. So focus on prevention. And then the other thing is no symptoms of heart disease: chest pain on exertion, shortness of breath on exertion, like swelling, abnormal heart rhythms, lightheadedness. If you're having these symptoms, seek medical attention early.
Thank you very much, Dr. Scantlebury. Dr. Don Scantlebury, our consultant interventional cardiologist, who joined us tonight to help us become a bit more heart smart. Thank you so much for watching this evening. And I hope that in some way the information shared helps to put us on the road to recovery. Russian playwright Anton Chekhov, he once said that knowledge is of no value unless you put it into practice. So your health, your action. Thank you very much to the Ministry of Health and Wellness, to the Starcom Network, and to the Caribbean Broadcasting Corporation. Until next week, stay healthy, stay safe.